Joining us tonight to talk about the recent spike of COVID-19 cases and its impact on hospitals is Dr. Edward Michelson. He is the chair of emergency medicine at Texas Tech University Health Services Center in hard-hit El Paso. Doctor, thank you so much for being with us tonight. When you hear that kind of phrase, another record in the U.S., 121,000 new positive cases in this country just in the last 24 hours. What do you make of that, and do you think it kind of solidifies the idea that we are in store for the rough winter that's been predicted for so many months now?
Well, unfortunately, Joe, yes, I think we are in store for a rough ride for the next couple of months. That number of 121,000, by comparison, was only about 98,000 averaged over the prior 2 weeks. And this week was the first time we actually hit 100,000 new cases in one day. So looking at the trajectory of how quickly these cases are going up, I think that's a cause for concern for all healthcare professionals.
Dr. Michelson, how worried are you about equipment, ventilators, hospital capacity in the next couple of weeks?
So hospital capacity is going to be tested for sure. The good news is that this rate of increase is not uniform across the entire country. Some regions are being affected more than others, and that's allowed us to shift people and resources from some areas to other areas. For instance, El Paso has been very hard hit, but the rest of Texas has been rising at a slower rate. So we actually have over 500 personnel who've been repositioned to help us in all of the hospitals in Texas, as well as those personnel include doctors, nurses, respiratory therapists. Without them, I don't know how we would survive this.
Doctor, we're not seeing the number of deaths like we did in the spring, and medical experts say that deaths typically lag 3 to 4 weeks behind. So do you think we will see more deaths in a month, or do you think these new therapeutics that we have coming online here are going to help keep the number of deaths down?
There's no way to avoid more deaths with this number of patients getting infected and this number getting hospitalized. But hopefully the death rate will be lower, thanks to not only the new therapeutics, but everything that we've learned about how to take care of these patients. So I know we had something like 1,100 deaths, I think, reported yesterday. That number will probably continue to rise, unfortunately, and we're trying to do everything we can to keep it to a minimum.
Dr. Michelson, I'm curious, there are so many people who have had the virus, who have not gotten over some of the symptoms. You hear the term long haulers used quite frequently. What can you tell us about folks who are still dealing with the symptoms and some of the fatigue and the brain fog? I mean, there is just a laundry list of things. Your advice to them medically to just get through these months that they're struggling?
Well, the first thing and most important is we don't want them to get sick again. I'm thinking about influenza, and I hope everyone has had their influenza shot by now, and if they haven't, please get it right away. Because the other potential problem is the combination of flu cases rising along with new COVID cases. Those extra flu admissions might just be the factor that tips us over in some cases. As far as patients that still have symptoms, my advice is to check with your physician. Fortunately, most patients recover and recover fully, but we do know that some patients, unfortunately, continue to have lingering symptoms, and we're still learning what that's due to and how to treat it.
All right, doctor, thank you very much for your time. We appreciate it. It's good to see you again.
Good to see you. Take care.